America is home to 33 million small businesses, the beating heart of communities across the country.
And proof that the American dream is still alive.
This is a show about those dreamers and doers and the communities they serve.
Their real life stories.
Their struggles and successes.
Their grit, determination, and passion.
And the people who fight
to keep their American dream alive.
I'm Alfredo Ortiz.
I'm Elaine Parker.
And it's time for another episode of Main Street Matters,
America's small business megaphone.
Hi, and welcome to Main Street Matters, America's small business megaphone. I'm Elaine Parker, the president of the Job Creators Network Foundation.
And I'm Toni Angelini, Senior Vice President of Operations and Advocacy for Job Creators Network.
Please subscribe to the show at salempodcastnetwork.com or wherever you get your podcasts from. Today, we're joined by Joel White. Joel is the president of the Council for Affordable Health Coverage. He spent 12 years on Capitol Hill as professional staff, where he helped enact 9 laws, including the 2002 Trade Act, which created healthcare tax credits. The 2003 law the 2003 law that established the Medicare prescription drug benefit and health savings accounts, the 2005 Deficit Reduction Act, and the 2006 Tax Reform and Healthcare Act, which reformed Medicare payment policies. Joel, welcome to Main Street Matters.
Thanks for having me. Great to be here.
Absolutely. Well, tell us and your audience about yourself and the Council for Affordable Health Coverage.
Yeah, so as you indicated, I worked on Capitol Hill for about 12 years, got to work on 9 different laws, including the law that created the prescription drug benefit for Medicare. Prior to that, Medicare beneficiaries didn't have access to prescription drugs. And so Republican Congress and President Bush decided that was a priority, and we did it. We got a great drug benefit to America's seniors and the disabled, and it's been working great for the past almost 20 years. And now, unfortunately, it's on life support because of what the Biden administration has done. And so at the Council for Affordable Health Coverage, which I'm the president of, we are working with like-minded allies to reverse that trend and try and make sure that our seniors have access to affordable drug coverage going forward, because right now the market is taking a nosedive and seniors are taking it on the chin.
Absolutely. And we've seen a lot of information come out on the Inflation Reduction Act that I don't think the public was fully aware of. And that bill was really what started this historic inflation that we've been suffering under for so long because of all the money injected into the system, essentially. But there was a lot of other things in there, specifically that affected healthcare as far as price controls that you're working on now.
Yeah, it's interesting. The Inflation Reduction Act, the IRA, has not broken through to voters as a healthcare issue, but it's having profound impacts on people's healthcare. So most people think of the IRA as a Green New Deal or green energy bill or a tax credit bill, but it changed Medicare in a significant way, and that's creating inflation in the premiums that seniors pay for their drug coverage. For example, just this year alone, a few minor changes. I think a lot of people have heard about the $35 insulin, maybe free vaccines, maybe a reduction in out-of-pocket costs for high drug cost expenses. That translated into a 21% premium increase this year. And next year, the premium increases could be 100% or more. And so for a typical senior living on maybe Social Security or a pension, that's going to have a big hit out of their fixed income. And it's going to make things a lot more difficult for them to spend money at their local grocery store or buy gas or engage in their hobbies or do anything that a typical small business would try and sell to them. So it's just making things so much more difficult. The inflation is not just in gas and eggs and rent. It's in Medicare too. And the thing that I find so funny is that it's not funny, it's sad, but that the president said that he was going to stick it to drug companies. Looks like he stuck it to seniors.
That is for sure. My 90-year-old grandmother lives with me, and I, am fortunate enough to be able to help her kind of navigate, her healthcare plans. The stuff that she gets in the mail, it's incredibly confusing for her, and she usually turns it over to me to sort of translate and figure out. And half the time, I can't figure it out. So I really feel for these seniors that are being just completely overrun with not only the financial hardship, but the bureaucratic nonsense that is coming, trying to just navigate what's approved, not approved, medications. I mean, you name it. You referenced the $35 insulin, though. Just want to go back to that for a second. If memory serves, that was not an original idea to the Biden administration, and it was actually the Trump administration who initially sort of planted the flag that insulin should be capped at $35. Talk us through sort of how that all came about.
Yeah, so insulin, I have a sister-in-law, 2 nephews, type 1 diabetics. They cannot live without insulin. They literally will. It's a life and death issue for them. For a lot of seniors, it's a life and death issue. You can't avoid it. You got to take your insulin. The prices of insulin were on the drug plans were pretty high. And President Trump saw that and said, we need to do something about that. So I want to set the record straight because there's been a lot of misinformation about this one. On May 26th in 2020, President Trump announced an out-of-pocket cap on insulin at $35 a month. And almost 2,000 of the Medicare drug plans provided that benefit, $35 cap on out-of-pocket costs. So 2 years before the law that President Biden and Vice President Harris claimed for the first time ever would cap insulin at $35 a month, President Trump had already done that, and seniors were getting access to that lower out-of-pocket cost savings. So it's kind of like the border, I guess. The Vice President Harris is just kind of borrowing the great ideas that President Trump had already had out there.
Yeah, same thing with no tax on tips. All of a sudden, that's her idea.
Yeah.
One of the things that the Biden administration is trying to tout is that the Inflation Reduction Act put a 6% cap on premiums, but my understanding is that only applies to something referred to as a base premium. Talk us through sort of the difference between the types of premiums and what it in real life looks like for these seniors that are dealing with these increases.
Yeah, this is a classic bait and switch, right? The authors of the law knew that they were going to put all these costs onto the health plans, and they knew the health plans were going to increase the premiums on seniors. So they snuck a provision in this law that limited the base beneficiary premium, as it's called, to no more than 6% growth per year. So most members of Congress who voted for this law, and it was all Democrats, this was a Democrat-only bill, and Vice President Harris cast the tie vote here, thought that they were voting for a law that said premiums would only go up by 6%. And that would still be a lot, because what we saw in drug coverage for Medicare is the premiums were pretty stable. They were about 0 to 1 to 2% per year. Some years they actually went down, and that's for the past 15 years. So Part D was kind of this success story of using markets and incentives to lower taxpayer costs and lower premiums for seniors. So the IRA loaded all these costs up onto the plans. The plans increased their premiums. The members of Congress thought they were voting for no more than 6% increase per year. But that only applies to the base beneficiary premium. And people go, what the heck is that? The base beneficiary premium only applies to what's called the basic benefit package. And most plans on the market, most seniors buy plans that are more generous. So they may have a lower deductible, or they may have less cost sharing. That's important for people. And so those premiums, the average market-wide premium actually increased by 21%. In 2024. So it wasn't 6%, it was 21%. And that's why next year, even though the 6% is still in place, only applies to a portion of the premium. Next year, we're looking at maybe 100% premium increases for a lot of these plans.
I mean, aren't we just going to end up seeing Medicare really just prioritize medicine that falls under the price controls, whether that's the right treatment for seniors or not?
Yeah, a lot of people have paid attention to these price controls, and look, these price controls are already negatively affecting the market. We've seen many companies defund clinical trials in areas like Alzheimer's, cancer, eye disease, cardiovascular disease. They're just shelving these products and saying it's not worth it for us to invest anymore, and that's the direct result of the price control. And what the government is doing now, when we designed the Part D program, we were very careful to say we didn't want politicians and bureaucrats involved in the pricing decisions, okay? Because they make political decisions and they decide you get this or you don't get that. And we thought a much better way was to hire the outside experts, the health insurance plans, not that I'm a fan, but the health insurance plans who negotiate prices all day, every day with drug companies, with hospitals, with doctors to see if they could get a good deal. And they've been doing a great job. That's why premiums have been just 0%, 1%, 2% a year. And it worked very well. The problem is politically, it was a great sounding point to say, well, the government ought to negotiate these lower drug prices because people assumed no one was negotiating lower drug prices. Well, now that the government's involved, what they did was they looked at the top 10 drugs that people use in Medicare, and they said, we're going to price control those drugs. And what they said was they just made it up. They just said it's going to be this price for these 10 products, and you can take it or leave it. The drug companies, they call it a negotiation. It's not a negotiation. They went in and said, well, we want to make a counteroffer, and those counteroffers were basically rejected for 5 of the 10 products. So the government was just setting the price. And that the challenge there is that for the products that were selected, those 10 products, they have competition. So these are products in cardiovascular disease, diabetes, other products. So now you've got some products that are price controlled, some products that are not price controlled. And what the plans are doing, they're switching to the non-price controlled products because they can make more of a profit by covering those products than the price controlled products. So at the end of the day, the government says that they did something. Some corporate interests are making money on that. And at the end, the patient is not actually directly benefiting from a lower drug price. The better way to do that would have been President Trump had put a rule in place that said if the insurance company negotiates a discount on the drug, that discount has to go to the patient that's taking the drug. And what the authors of the IRA said was, no, we've got a better plan. We'll have the politicians negotiate a price control, and we will repeal or push the Trump requirement to pass that discount onto the patient. We're going to make sure that doesn't apply until 2032. So that means the patient never gets the discount at the pharmacy. There's no requirement on the plan to pass the discount to the pharmacy. And you have a bunch of politicians saying that they've done something for patients when what really is happening is their premiums are going up by double digits. Historically, it's never happened before. So this is a real problem. The market's kind of falling apart, and we'll see what happens next year after the election. But this is something that politicians aren't going to be able to ignore because it's going to get so expensive and so difficult just to get these products.
So it feels like the politicians don't know how to talk about this. At least conservatives don't know how to talk about this so that the public understands. And it makes the pharmaceutical companies an easy target for the corporate greed argument, and that they're sticking it to patients who can't afford drugs. But where is the messaging? And maybe it's not the politicians' responsibility. I'm not really sure. Maybe maybe it should be the pharmaceutical companies explaining this is how we get a drug to market. We spend billions of dollars trying to get a drug to market. And of the 150 that we try, 2 make it. but all the money went into, studying 150 of them. We have to recoup those costs so that we can do it again and keep improving the drugs. I mean, that's just what's missing, because people do buy into the greed. I mean, there are people buying into the grocery store price gouging argument right now.
Yeah. Well, it's gotten very expensive to live in America the past couple of years, and so people are looking for villains, and they're looking for solutions. And unfortunately, here's the real story. What's going on? If I'm a senior, my mom's 90 years old. She's got a Medicare drug plan. She pays a premium to that insurance company to cover those drugs and to pay for those drugs. Now, she has to pay cost sharing on those drugs. So every time she goes to the pharmacy to pick up that drug, the plan charges her a copayment. And what's happened is those copayments have gone through the roof. So everyone's got insurance, but everyone's complaining about the high cost of drugs. Well, it means the insurance isn't adequate to cover the costs at the pharmacy counter. And that's really the problem that we need to be solving for, because otherwise the premium is just going to a low-value product. So that's what President Trump was trying to do with his rebate rule, was to say, I'm going to require your health plan to give you the discount that they negotiate, because right now they're holding on to that. So, the Inflation Reduction Act did the opposite. It said, we're going to get you a lower price, but then we're not going to require the plan to pass that along to you. So it's just all backwards. But I think if you think about drugs, we want more drugs because they keep people healthy, or they help with their chronic disease. They prevent disease progression. It's really expensive to develop those drugs, but it should be a benefit to the patient to buy a health plan that covers those drugs and create an affordable copay at the pharmacy counter so that they can actually take those. Right now, 92% of seniors are maxed out financially, meaning they can't afford one more dollar on top of what they already have. That's according to a recent survey by one of our members. And 38% are basically struggling. They're making different decisions, like putting stuff on their credit cards, or cutting what they pay for food, or trying to move into a different apartment or living situation. This is not good. If we go from a 21% increase in 2024 to a 100% increase in 2025, we're going to have a bunch of people who are going to be getting off their drugs, getting sicker, ending up in the hospital, racking up a bunch of charges they can't afford, and quite frankly, taxpayers can't afford. So we got to fix this. We've got to change the IRA. We got to get rid of it, in my opinion, and get back to a system that's affordable for seniors in America.
Have you spoken with leadership at all in the House? Because I thought that I read, maybe even this morning, that Speaker Johnson would not repeal all of the Inflation Reduction Act. I don't know the reasoning behind it. Have you heard that? And do you know what parts he would repeal or would want to keep?
We've had hundreds of meetings this year. We've met with everyone in leadership, all the way down to the rank and file, all the policy committees. We've testified to Congress on this law. I think that most members that you talk to will tell you we need to repeal the whole thing and start from scratch. I think what Speaker Johnson was probably talking about was there was zero bipartisanship on the Inflation Reduction Act, and especially around these price controls, because it would have such a devastating effect on new and innovative product development and cures for cancer and diabetes and things like this. Where there was bipartisan agreement, and what Republicans and Democrats both agreed on, was capping seniors' out-of-pocket costs. And the way the original prescription drug benefit was designed was that seniors and the disabled paid 5% above an out-of-pocket limit. And for some, about 1.5 million people out of 66 million, that was a huge burden. They had costs above $2,000, and they couldn't afford, for example, if their drugs cost $100,000 a year, they were paying 5% of that. So those people couldn't afford that, and that was a real problem. The challenge is this law was enacted completely partisan, and the way the Republican alternative worked was it would have phased in the changes over time, so the premium increase, the hit, wouldn't have been 21% this year or 100% next year. It would have been capped truly at 6%. And that would be a better benefit, and it would be an easier pill to swallow, if you excuse the pun, on the premium side. So I think that's probably what Speaker Johnson's referring to. I think that, we get on the other side in November, members are going to be taking a hard look at this law because there's just chaos in the market right now.
Talk to us a little bit more, forward thinking. You were on Capitol Hill for 12 years, I think you said. That's a very long time. Those must have been like dog years. So I'm sure you have a lot of insight into sort of, how the sausage is made and how back in those days when there might have been some more bipartisan spirit floating around Capitol Hill. How do we fix this? What does it look like for seniors in the next, not just the next 5 years, but the next 20 years? How do we get this under control so that you don't have somebody choosing between, their diabetes medication and eating?
Yeah, it's an important question. It's a hard question, right? Like, there's not a lot of bipartisanship on the Hill right now. I think that's intentional. I think that the laws that have been jammed through in the past couple of years have been totally partisan. And now with divided government, we're seeing basically where the House is passing a lot and the Senate is just kind of not doing anything. They're working on nominees and show votes. And I think that the one thing that's going to change things after the election this year is our fiscal situation. We have a mess. We are spending more today on interest than all of national defense. So every aircraft carrier, every troop we pay, every bullet we buy, every missile system, we spend more on interest than all that stuff. And just in healthcare, we spend more on healthcare programs than all of the stuff we decide to spend on every year. So education, justice, agriculture, defense, all that stuff is dwarfed by healthcare. So we can't ignore it anymore. I think every great country has kind of gone down the tubes because we've taken on too much debt. That's where we're at right now. And healthcare is a big driver of that. And so I think that what I've picked up from my conversations on the Hill is bipartisan interest in trying to figure out how do we start making some appropriate changes in healthcare so that we can start lowering not just seniors' costs, but taxpayer costs and get back on the right track. The other thing is, there are guys up there. I think Speaker Johnson is genuine. I see folks like Mike Carey from Ohio, who's in the Congressional Civility Caucus, who are building legitimate bridges across the aisle. I see leaders like Jody Arrington in Texas and Blake Moore out of Utah, who are fiscal conservatives, very conservative members, but they treat their Democrat colleagues with respect, and I think that builds a lot of trust, and members can figure out from there, what do I actually want to accomplish? Do I want to do something, or do I want to stay up here and do a 15-second Twitter performative politics video clip and go make $1 million fundraising? That whole environment, though, is going to change because of the fiscal situation.
We certainly hope so. One of the things that Job Creators Network we spend a lot of time talking about the free market, protecting the free market, and really getting government out of our day-to-day lives as often as we possibly can. How, I'm sure that people on the left would say that if we just turned healthcare back over to the free market, that the entire system would collapse. But how do you envision ultimately decoupling, Washington, D.C. from the decisions that are being made inside an exam room between a doctor and a patient?
Yeah, it's such an important question. I think conservatives have failed in talking about our vision of healthcare in a way that resonates with voters. And so we have great ideas. We just don't message them well, to your previous point, and we don't explain the benefit. So Medicaid, we have. It's not an accident we ended up with 90 million people on Medicaid. We've created one-way streets to go from employer coverage to Medicaid or employer coverage to Obamacare, where taxpayer costs are 3 times more expensive. It's about $9,000 per person to insure someone on Medicaid. It costs about $3,000 to keep someone with a tax benefit on employer coverage. But we've created these incentives where small businesses in particular can't compete with these government subsidies. So in 2014, we had 18 million people get their coverage from a small business. Okay, today that number is 8 million. It went from 18 million to 8 million in just 10 years. So the small business market for healthcare is in free fall. It's a death spiral. Like the costs are through the roof. These guys can't afford it. And so they can't afford to attract and retain talent. That hurts us on economic growth, right? So we've got to explain, why is that coverage better? Here's why. You get better access to doctors. If you're on Medicaid, you got a card, but you can't find a doctor to treat you, so you go to the emergency room because your kid has the sniffles or an earache. So you end up in a more expensive setting. If you're on Obamacare, your average deductible for the most popular plan is $5,000. If you're in small business, you have broad networks. You can see pretty much any doctor you want. They want to see you. They want to take you. You don't have to go to the emergency room like you do in Medicaid. And your average deductible is about $1,500. It's about $3,500 less than if you were on the government program. That helps people get access to the care they need. There's a broad selection of doctors, drugs, high-quality care providers. So we need to be talking about the benefits of free market, private sector health coverage versus how compassionate it might be to get someone on Medicaid, but once you get on Medicaid, you can't see a doctor. That's not compassion. That's a bait and switch.
I think we have to get people educated and wanting to be educated and take responsibility too for their health care. And I think that's an important step as well. It is complicated, though. The other side of that coin is it's so complicated, and I don't think it has to be. But you raise a lot of good points. What can our audience do to have their voices heard? Can they go to your website? Can they send letters? Tell us how to find you.
Yeah, if you go to cahc.net, N-E-T, we've got a whole section there on the Inflation Reduction Act, what it does, how it's hurting people, and we encourage anyone go there, use the material on that website, contact your member of Congress, and say this needs to be fixed. You can also engage us on X at C4AHC is the Twitter handle. And we also have a LinkedIn page, but if you go to Twitter, there's a number of things that we put out in specific geographic areas around the country where premiums are going up, not just by 21%, but by 30, 40, 50%. You can take a look at some of those videos and click through. It's an activation. You can do that. And then I think in the town hall meetings, members of Congress are going to be back home campaigning for re-election. They're going to be doing multiple community events. Show up at your event with your member of Congress and ask them, do you support this Inflation Reduction Act that's increasing premiums by 100% or more? What we've seen across the country, and I'll give one example, the race in Wisconsin for Senate. The Democrat was running an ad about how great the Inflation Reduction Act, the challenger put up a counter ad and said, this law is increasing your premiums by 21%. The incumbent Democrat took down their ads and immediately went on defense. So they want to run on this. They got to own the whole record, and the record is not a pretty one. So we're not advocating for victory or defeat of any candidate. What we're saying is this law needs to be changed, and the people who wrote the law need to be held accountable.
That's a great message. Again, on X, it's at C4AHC.
Yep.
Great. I will definitely follow you. Well, Joel, thanks.
And CAHC.net is the website, and you find more material there than you can use, but a lot of good one-pagers that lay this out very clearly.
Excellent. Thank you so much. Well, thank you for joining us on Main Street Matters, America's Small Business Megaphone. And thank you to our audience for tuning in. Main Street Matters is part of the Salem Podcast Network. New episodes debut every Wednesday and Friday. You can subscribe to the show at salempodcastnetwork.com or wherever you get your podcast from. And we'll be back soon with another episode.